So today there are 50 new cases to report of COVID-19, made up of 26 new confirmed cases and 24 new probable cases. There are no additional deaths to report. So there are now 282 reported cases of people who have recovered from COVID-19 infection, an increase of 41 on yesterday. The new total of confirmed and probable cases is 1,210. Today there are 12 people in hospital with COVID-19 infection, including 4 in intensive care, 1 in Wellington, 1 in Waitemata, 1 in Counties Manukau and 1 in Southern. 2 of those people are in a critical condition. For the cases we have information on, we are seeing a strong link to overseas travel, though that continues to decline as a proportion. It is 41%, as well as links to confirmed cases in New Zealand at 43% and community transmission at 2%. We are still investigating 14% of the cases. There are still 12 significant clusters, and the numbers for our 3 largest clusters are at the Marist College in Auckland, 84. The Matamata cluster has also 84 and Bluff 81 cases. In terms of testing, yesterday there were 4,098 tests processed, bringing the total number of tests carried out to date to 46,875. That yesterday was our highest number of daily tests, and the 7-day rolling average is now 3,343. Our testing capacity continues to increase despite that increase in the number of daily tests, and we now have stock for just under 50,000 tests, and that continues to grow. I know there is interest in healthcare workers who have been infected with COVID-19, some of whom have travelled back from overseas and or have acquired it locally, either in the community through being contacts of existing cases or indeed potentially in the workplaces. We do have a breakdown of those workers, and the biggest categories are there are around 20 support and care workers working in both hospital and or care in the community settings, 17 nurses, 7 are in administrative related roles, there are 7 doctors and 3 medical students. We do know, as I said, that around a quarter of those health workers affected have actually travelled back from overseas, so they've acquired their infection offshore, and we are working on a breakdown to determine of those who have acquired the infection onshore here, what proportion was inside the workplace and what was outside the workplace. We've also been able to collate all the data on laboratory testing and break that down by District Health Board and look at the ethnicity breakdown. And we'll be providing that information on our website. We are still waiting to complete the data set to include the Waikato lab data. And so far, though, if we look at the 35,000 people for whom we do have testing, if I look at the ethnicity breakdown, 13.6% are Māori, 7.8% Pacifica, Asian is 12%, European and other 64.2%, and Middle Eastern and Latin American 2%. We will provide those data on our website and update them regularly. Final comments, flu vaccination. I just want to encourage people who are in that category who receive publicly funded vaccination, pregnant women, people with pre-existing conditions, and those over 70. It is essential travel to go and get your flu vaccination, and practices have got ways to vaccinate you, including coming out and doing it in the car if in some cases. Please do. That is essential travel, and it's very important to get those vaccinations now. And that goes for other care you might require at your general practitioners. Do not hesitate going and receiving either care for an acute condition or your usual care for chronic conditions you may have. That is also regarded as essential travel, and you will not get in trouble with the police for doing so. We do have plenty of flu vaccine supply that has been distributed in a managed way from the centre. I will now hand back to the Prime Minister.
Thank you, Director General. As Dr Bloomfield has highlighted, today we have the highest number of tests reported in any one day and the lowest number of new cases in 2 weeks. We may yet see bumps along the way, but as I said yesterday, I remain cautiously optimistic that we are starting to turn a corner. It's all the more reason to stay the course of our self-isolation as a nation. As I said yesterday, we have also surpassed 1 million New Zealanders being supported by our wage subsidy scheme. One of the key principles of the wage subsidy scheme is that we keep people connected to work. There's another sector that's doing this alongside us, and that is our primary sector. You will have seen earlier today that the Minister of Agriculture highlighted one of our star export performers, horticulture, that is keeping New Zealanders both fed and in jobs at this really important time. Overseas workers traditionally fill many roles in our fruit and veggie growing sector, but as you can imagine, the action that we've taken as a government at the border has meant fewer overseas workers have been available. And now, amid our kiwi fruit harvest, we're seeing reports that those workforces now have over 90% New Zealand staff compared to 50% last season. Last week alone, more than 100 staff were placed into roles in the Bay of Plenty, Auckland and Nelson. The pip fruit industry, made up of apples and pears, has seen around 200 workers from other industries placed into jobs across the country. So today I want to give my thanks to our food producers in every part of that workforce for continuing to look after us and for the actions in that industry to make sure that people remain in employment. Now, I know there are some workers on our orchards at the moment from the Pacific, working hard here while Cyclone Harold crosses their homelands, particularly Vanuatu and Fiji. And I can understand the worry that you will have for your families. A quick update on that front. This morning, a P3 Defence Force aircraft left New Zealand to provide much needed surveillance of damage. I expect that will actually be happening as we speak. We also have the C-130 at the ready to deploy with essential supplies. In the meantime, our thoughts are with particularly the nation of Vanuatu as they come to grips with the impact of that cyclone and understand that we, of course, are still building a picture of just the scale of that cyclone as we speak. Today I also have an update on how our aviation relief package is supporting our industries as well and keeping our isolated communities connected. You'll recall that we set aside $600 million in our COVID relief package to support this key part of our transport infrastructure. As you can imagine, air freight connectivity is really critical for our remote communities. They also help ensure we receive urgent supply of medicines, PPE and critical equipment. We now have 8 initial support agreements with airlines and a ground handling company around the country, totalling up to $4.7 million. And of course, we need to make sure our regions are easily able to access critical time-sensitive freight, food, medical supplies, blood donations. So the Chatham Islands now have their Airlink secured, and Air Chathams is making 3 trips a week, making sure residents get what they need. This package is also providing support to the likes of Air Napier and Barrier Air. In addition, most of our high-value goods were carried overseas in passenger aircraft, and of course many of those are no longer flying, and so we've stepped in. Supported by our relief package, Air New Zealand has now made 17 flights since Monday last week to Shanghai, Hong Kong, Los Angeles, San Francisco and Sydney. At least 18 more flights are planned over the next 10 days. They are taking food overseas and returning with cargo, which includes PPE, hand sanitizer, thermal imaging equipment, test kits and flu vaccinations. We know we need to do more though. This is not just a short-term challenge, so we've committed $330 million to supporting international air freight over the next 6 months. We've received 16 proposals from airlines and carriers all over the world to help critical air freight continue, and we're evaluating those proposals as we speak, and we'll have further announcements later this month.